Aloha and welcome to the Greatest Exchange. I'm your host, Krislen Baroga. Here, we talk about real life scenarios as it is the heart of Hawaii, business owners, heroes, and leaders, because we believe that your story needs to be heard. Today, we're here in the beautiful second city of Kapolei, and in this glory story is brought to you by my sponsor and my trusted eye care provider, Dr. Hank Makini, and as well as Dr. Maika Teal. How are you guys doing today?
We're doing great.
Yeah,
Thank you
great.
so much.
Thank you so much for having us on.
Yes, no, I'm such an honor to have you guys here because I have been a loyal client of yours since 2022 and fast forward 3 years now, going strong. You guys have been supporting me with every season I have been walking through, whether it be the care for my eyes. As you guys can see, I am running for Miss Hawaii, and I did share that you guys are my sponsors. Want to extend my gratitude.
It's our privilege because we've known you, just the woman of God that you are. And so we just think that this is such a great opportunity for you to be a part of, this journey. We want to be a part of that journey. So that's why we definitely want to be a sponsor. Getting to know you and just following everything that you've been doing, we're so proud of you. And it was an easy decision to be a sponsor for you. Yeah.
Oh, that's so precious. Wow. Well, thank you. Yes, I'm so thankful. Truly, truly honored. But okay, let's get right into it. I actually have a fun question for you guys. What is a life like as an optometrist?
Very good. I think you're going to hear two perspectives because I've been practicing for 38 years.
Nice.
And this is Dr. Teal's, who I call Maika. It's going to be his first year. He's in his first, actually, no, is this your second year?
Technically.
Second
First year,
year.
it's
Second
second
year.
You're just
yeah,
a baby.
Yeah.
Yeah, so we have different perspectives, but I think, because we talk about this a lot, I really feel like I bonded with Micah when I met him.
That's so
because
important.
his heart
Yeah.
toward the patient. Just asking him what was some of his interest in optometry. The first thing he said was, it's the patient care. It's how he takes care of the patient. It's that connection that he has with the patient. And that was mine as well.
Wow.
When I was his age, when I started out in optometry.
Yeah.
We do provide the state-of-the-art care that we have. It's our interpersonal, how we educate. We're an office that prides ourselves on being able to educate our patients, everything we do. We want to empower them with knowledge, and that helps to give them a positive attitude toward their eyesight and toward what they do to take care of themselves and their families. And it makes a difference. We want to be able to not be just doctors within a room. We want to be a doctor of the community so that we can, so
That's so good.
that's so important to us.
Very much so. That's awesome.
If I could piggyback on that, one thing that I've learned a lot after starting to work here at Eyes Plus, Dr. Makini really taught me that, you're not just talking to one person, you're actually talking to the community during our exam, because whatever you educate the patient with, they actually go out and say to their friend, oh, hey, my doctor told me this. And if we're educating as much as we can and getting these patients to understand their eyes and introduce them to their eyes, then they can actually help others outside of the office as well.
That's awesome. Yes. So even with Miss Hawaii organization, we are very big on service. And so to hear that our core values are very similar, I can't wait to see what this year holds with collaboration of working in the communities and also sharing about Project S.A.V.E. That is just so exciting.
When I met him, it was so great because it was through a friend of where the church that he attends, his parents' church actually, and she's my patient, and she's the one that actually had asked if I would be able to mentor.
Oh.
Yeah, Maika.
Okay, I'm sorry, I don't want to interrupt, but you went into eye care. Did you ever want to become a pastor?
I haven't really thought about that. But with my parents both being pastors, they've definitely kind of made jokes like, hey, maybe one day you'll get your calling, one day, because I've been really focused on school. I just finished last year, so getting more involved in the career that I've been studying for the past few years. But you never know, maybe one day it'll be my time to lead the church.
For sure. What inspired you to become an optometrist?
So I actually started wearing contacts when I was a freshman in high school.
Ditto.
And yeah, perfect. So I played baseball, football, and I paddled.
Nice.
And I didn't realize how much I was missing. So when I put contacts on for the first time, one, it changed my game, right? My performance shot up and I was way more comfortable in seeing everything I needed to see that I wasn't seeing before.
For sure.
And also just living in Hawaii, it's such a beautiful place. Going to the beach, going on a hike, all those kinds of things that I did growing up was so much more special, being able to see things clearly.
Yes.
So I really wanted to help others see the world the way that I do.
I can see clearly now, the rain is... Okay, yeah, come on, let's go.
Very good.
Okay,
Probably, it's so interesting is, I wanted to mention that when you said about what's a day in the life, and then how Maika shared about what inspired him. So I kind of came into optometry a different way, and so I have a program called Project S.A.V.E. And actually there's academic vision care, which is my program as well. Academic vision care is a program and a method in which I help children reach their full potential academically. I actually grew up challenged in school. And so I had a hard time learning. I was more of a C student, and I didn't know why.
I could not believe that.
Yeah, and so I didn't even want to go to college. So because I listened to my parents and my parents said I had to go, I did. And through that time, and actually I was so encouraged by the people around me. My grandfather, who's a retired reverend at the time, he was a mentor in my life. So there was these different things that happened in my life that directed me toward optometry to try, even though academically I may not have been the best candidate, but there was something inside of me that I wanted to be able to help people. And that was really a strong desire I had. So at the school I was at, Pacific University, when I actually attempted to get in, eventually I did get in, and I was afraid of failing because of my past, but I really believe God at that time directed me of how I learned, and He was able to help me understand.
This is so fascinating. So I am so intrigued to know, out of all of the practices here on Hawaii, what makes you guys outstanding and better than most?
Oh, this is good. Where do we start, right? Let's see. Well, first of all, we are probably one of the largest pediatric optometrist offices, where we start seeing kids at age 3.
Wow.
And besides academic vision care and Project S.A.V.E. that we provide for the kids, we also provide
so myopia management, we're starting to bring that in. So myopia being nearsightedness, when kids can't see very far, it tends to have their eyes keep going and going. So we're able to actually slow that down so that it doesn't get too bad as they grow. Other things that we have too here at Eyes Plus is we're about to start a new kind of journey with a frame called Nuance. So Nuance is sort of like a replacement for a hearing aid, where it's in your glasses. It has directional microphones so that you can kind of hear things in front of you more, and you can also hear things from the side as well, but it's a lot more comfortable than having earpieces in all the time. And that's one brand new thing we're bringing in that we're really excited for.
That is so interesting.
Yeah.
Wow.
And then why don't you talk about Maryland?
Yeah, so we are a medical office, so we do treat eye infections and things like that. We also follow patients who have diabetes to make sure there's no diabetic retinopathy. If they are, we can help them get the care they need.
Pre-diabetics as well?
Pre-diabetics as well. We treat glaucoma. We help be able to detect cataracts are all medical. One area that we're really happy about is having NeuroLens. We now have had it for 2 years. It's a way that we can actually use lenses to be able to influence the relief of migraines, which after 38 years, I've never really been able to do that. I've only helped patients, be able to manage their migraines just kind of through talking and making sure they're getting care from a neurologist or from their PCP. But this one has been groundbreaking, where I've been able to help patients where where they had migraines. I had a patient who actually had a level 9 migraine every single day. And with the NeuroLens, wearing the NeuroLens, it actually brought it down to a much more level that was that brought so much relief to her as a mom and as a military mom, basically raising her family by herself while dad's deployed. It just made her life so much better. And she sees a neurologist, and she wasn't able to get the treatment, wasn't able to bring that relief to her, but this NeuroLens made a huge difference.
Wow, that's amazing. As you're speaking that testimony, like my ears keeps getting bigger. Just the things you guys are doing for our family and the communities, it's a game changer. I pray that the Lord will continue to bless this company and may continue to prosper and maybe even expand to the mainland, to other islands. That'd be
Thank you, Cassie. I can tell you that, what your podcasts are for, and most importantly is to give honor to God. So we do give honor to God and to our Lord Jesus Christ for everything that we have. Yeah.
Yes.
Every morning when we start our day, as a team, we do a powwow, and then we have a prayer. And, one of the things I do when I pray is I just thank God for the opportunity to serve people, which is a passion that we have. As doctors, we have that. And that's what we have. That's what our team has. And we focus on that in the morning as we begin our day, that we want to focus on the patients and their needs and to be able to meet those needs.
That's so awesome. So that's one of your guys' core values here, is to start in prayer, giving thanks, and doing like a team huddle.
Yes.
Yes.
Yeah, definitely.
Yeah. You can definitely also feel the shift when you do not start a day with him. I'm gonna be very raw with you guys right now. So I actually did not start my day with the Lord. I started with a million tasks that I had to finish today. And so, but as of right now, this is such a great exchange where we get to pour into each other's lives. I am so intrigued to ask, on eye health tips, what are some daily habits that support long-term eye care?
Good. You want to take that?
You want to take that? Okay.
Okay.
So there's a lot of different things that we can do in our day-to-day life in order to keep our eyes healthy. The first thing, especially being here in Hawaii, there's so much UV, right? So sunglasses work wonders and will help protect your eyes from things like cataracts and slow that down, macular degeneration, all kinds of things that go on in the eye that you wouldn't really be able to tell until later on in your life. So sunglasses will help protect you from that in the future.
Wow, yeah. Good to know.
Mm-hmm. And can I probably piggyback on that? That wellness is so important for the eyes. I have a question I ask patients when they're here, and I ask if you had to give up one, your eyes or your teeth, which would you give up? And nobody ever says eyes. But it's interesting culturally how people were brought up knowing how to take care of our teeth, because dentistry does teach how to prevent tooth decay and go in for your cleanings and make sure you get your x-ray and do that annually. But eye care, we do something so important, and people, when they answer that question, always say they would never give up their eyesight, but they've never been taught how to take care of them. And wellness is merely the simplest part of bringing wellness to your eyesight is actually coming in for a routine eye examination every year. Yeah, because wellness is so important. It's one thing that is missing that we don't teach as a profession. It's implied, but not taught like dentistry. And that's why here at Eyes Plus, we actually teach wellness. Yeah, to be able to preserve sight. And wellness isn't just health. Wellness is quality of life. It's how a child develops academically. It's how people will be in front of someone who works in front of a computer 8 to 10 hours a day, and their eyes might be getting dry or irritated. And it's because of something that is because of all that screen time, but yet there's things that we can provide that helps to preserve their eyesight and also make it easier, make them more productive at their workplace, a better employee, and actually a happier person when they get home.
That's so crucial. Yeah, actually, just last night I was at a soft opening for Kapolei, and with that they had a guest, and he was sitting on the chair, and I noticed that he had the stick walker. What do you guys call that? Yeah,
that's like
because right, because he did not have any sight in his eyes. And I got to sit down with him, and I just got to ball out, and he was like, "Oh, I'm sorry, I can't see." And I said, "That's okay." And I asked him, I was like, "How long were you blind?" And he goes, "It just happened like a couple years ago." And I really just had this like one-on-one, like I was just like, had so much sympathy for this guy. And so as you're speaking, it's so crucial, because you never know, right? You never know. You could just wake up one day. So what are some of like the early signs you could have someone, if they're already feeling something in their eye or whatever the case may be, where they need to come out and to see a vision care?
I'd like to speak to, because that's actually very common. That's the thinking that most people will have is, what's the symptoms? If we were to, and I'm going to bring in dentistry as a contrast again, is if you were to say, how would you know if something's wrong with your teeth? Well, people could answer that, but most people would say, well, why would you want to wait for that?
Right.
Yeah. Why don't you go in and have the dentist look at your teeth and make sure that never happens?
Yes.
And that's the preventive side. And with eye care, like for instance, we'll talk about glaucoma. So glaucoma is actually a condition of the eye that's related to the fluid inside the eye that presses on the optic nerve. And it can damage nerve fibers. Now here's the thing, if a nerve fiber is ever damaged, there's no pain. There's a change in your vision, but it's so small you don't know that it happened. So it's a silent, glaucoma is silent. And the test that we do to find if a person has glaucoma, there's no COVID test for it. There's no definitive yes or no test. The only way to find it is through comparative testing, which can only be done through routine examinations.
Which you guys provide.
Which we provide.
Yes.
And glaucoma, which was thought to be only for older people, or it was only genetic, so if the family had it, you would get it. But actually we're finding, the more research we do, the more we find out that we don't understand everything of who's going to get that.
Right.
Even 16-year-olds can get glaucoma. So right now it's not limited to an age group.
Right.
Yeah, or the kind of eye you have.
And that's just one example of something that can go on without you really knowing.
Yep.
There's also a ton of examples where like your kids don't know what's considered clear because they haven't worn glasses before. So when they come in, we can actually show them what perfect vision looks like. It could actually change their whole world, and then they'll be like, wow, this is amazing,
Right.
And that's one thing that we really have a passion for is something that really lights my day up is when I put up glasses on a kid for the first time and their face lights up like, wow, this is amazing.
I definitely remember that day. I believe I was telling your office ladies, and I was like, I can count all the leaves on the tree right now. I was in a whole new world. So yes.
When you say a whole new world, we're talking about a perspective. And that's one thing we love to do, is to change perspective. And when people think of eyes, they usually think of good or bad, weak or strong. So usually bad eyes are the ones that need to see the eye doctor, and the good eyes, you don't have to. Well, that's not true, as we just kind of spoke about glaucoma. So we like to change that. When it comes to the kids and what Dr. Maika just mentioned, we look at the eyes as by shape and by performance, because farsighted and nearsighted astigmatism are actually, they are by shape. They become because of the shape of the eye, which is genetic, and they perform differently too. Farsighted sees better far, nearsighted sees better near. Astigmatism is a split focus, which is one thing that I always remember when it comes to reading, or how kids might look at something and see it a certain way, and they think everybody else sees it, is a split focus, being able to see words where you don't see all of the word, you only see part of it. So you're having to actually visualize and use more cognitive effort just to be able to recognize a word, much less comprehend. And there's so many kids who have about 30%. What is that? 3 out of 10 kids have
Wow.
astigmatism, and they can easily be having difficulties in school, but they can still, with that split focus, call out a letter that's 20/20 on a chart, or
Wow.
20/30, which is pass-fail for pediatricians. So they can actually be missed easily and be suffering in school, and then they can be misidentified as maybe a learning disability or worse, ADHD.
Wow. So you guys now understand why it's so hard to believe that Dr. Hank was a C student. He has this in the back of his mind. Your knowledge, your ike, is so powerful, and the people, your clients, are just so blessed to have both of you guys as doctors. I myself am so honored. Once more, like I said, right? It's really not just you guys being my eye doctors, but educators, and we really need that. So, can you actually talk about your program, SAVE?
Project S.A.V.E. stands for Supporting Academic and Visual Excellence. It was created back in 2000, and it was on that same factor when a child is being misidentified as ADHD or learning disability. They're usually taking down a path where how they try to help the child, they're not responding the way they should academically.
Right.
They might give them medication if they think they have ADHD.
Right.
It causes them not to be distracting anymore, but they still do poorly in school. But when we find that it is due to vision, because of just how vision can become a distraction in and of itself to the brain, that's when we find that by solving that, by allowing vision to be its best for that child, optimize it. It optimizes their thinking. Did you know that there's been a lot of research already that shows, and this is back all as far back as the 80s to now, and there's multiple studies that have shown that 80 to 90% of all sensory information that the brain uses in order to learn comes through vision. So one of the things I always like to tell patients is, or parents especially, or teachers, is that if the brain uses 80 to 90% of a person's vision, we should know how that vision is performing.
Wow. So
And
crucial.
that's really what Project S.A.V.E. is about, being able to strive for excellence in both academics and vision, because they together hand in hand.
Okay.
Also, if you have any questions, you guys can feel free to give us a call and we will point you in the right direction.
That's awesome.
Mm-hmm.
Yes.
Yeah.
Would you look at that? It's a one-stop shop here at Eyes Plus. Well, once again, this is the greatest exchange, and that concludes it. I hope you enjoyed every part of this conversation. I hope you was educated and inspired. Mahalo again to Eyes Plus. If you guys liked and enjoyed this video, many more to come. So please like and subscribe, and the greatest exchange will come out with a new glory story coming to you every Mondays. Aloha and have a blessed day.